Hi, doctor.
Hi, Cynthia.
How are you?
Good. To clarify for everybody else, colic هو بالعربي المغص. Okay.
Yes.
So just to clarify for everybody else, there is actually a definition for colic.
Okay.
Okay. بنقول إنه معه
ممغوص.
colic. Okay. ممغوص. So the definition of colic is crying for at least 3 hours
Okay.
continuously 3 times a week. Okay.
Yeah.
So if they
Okay.
do it once for one day,
Okay.
ما بنقول إنه this baby has colic. يعني we don't label
Okay.
the baby as they have colic. So there is
Okay.
actually a definition for that. So it's crying for more than 3 hours,
3 hours,
3
3
times a week.
times a day. A week.
And
Okay.
a
Perfect.
week, yes. So, and interestingly, it tends to happen at around the same time. Okay.
Okay.
So it usually happens at night.
Okay.
It happens in children usually after the 3rd week of life. يعني it can
Okay.
start to happen at the 3rd week of life. I
Okay.
always tell my patients when I actually discharge them from the nursery, إنه إذا بكي البيبي the first 2 weeks, there's a reason for that. Okay. It's not colic. يعني
بده ينام.
نعسان بده ينام بدنا نغير
Diapers.
diaper. Sometimes they just need to be skin to skin with their mom.
Exactly.
That's all it takes. So there is
Exactly.
actually a definition for colic.
Okay, perfect. I love it. So 3 hour crying for 3 hours, 3 times a week, usually at night.
Yeah.
And usually it starts after the 3rd week of life. And usually, doctor, how long does it last?
Maximum.
Or depends.
Maximum 3 months. Maximum.
Okay.
يعني
Okay.
مش it lasts 3 months. It goes away by the 3rd month of life.
Okay.
So colic typically happens between the 3rd week and the 2nd month. يعني هيدا البيبي اللي عمره شهر بين الشهر والشهرين. Basically, this is when colic happens. Okay. So إذا baby عمره 4 months, 5 months, and this is happening, this is likely not colic. So we need to make sure that there's nothing else that we're missing.
Okay. Okay. Well, usually what are the symptoms other than crying, you know? شو ممكن يشوفوا غير crying?
Actually crying. Actually crying is the only thing. And interestingly, kids, when they have colic, they eat normally. Okay. They are healthy. يعني مش إنه they cry and they vomit or they cry and they have diarrhea.
Okay.
They might pass some gas لأنه gas in the stomach and in the intestines. يعني إذا البيبي عنده غازات كتير, this is the explanation of colic, why it happens sometimes. So they might pass some gas, but usually they are fine. And they're just crying. They're just crying. This is what happens. So if they have other symptoms like fever or they're irritable, they're having diarrhea or vomiting, then this is not straightforward colic. This is something else.
And this is one definitely they have to consult the pediatrician.
أكيد.
Yeah. Okay.
Yeah.
So عادة it's the main thing يعني the main symptom is seeing the baby up, right? And then again مثل ما قلنا 3 times a week.
Yeah. So if the baby cries 1 time for 3 hours, this doesn't mean that this is definitely colic. So it really needs to happen for a week, 3 times a week قبل ما نقول إنه هيدا البيبي عنده colic, as long as there's nothing else going on.
Okay. Okay. Perfect. Or is there a way to prevent it or avoid it sorry, or it's like all newborns might go through this?
Not all newborns have colic.
Okay.
Actually, less than half of newborns have colic. يعني the rates, if you look at the literature, the rates are around 40%. Okay. So it's still less than half. It tends to be overdiagnosed. يعني كل ما يبكي البيبي بيقولوا moms and the grandma انه ممغوص واعملي له ما بعرف شو كذا بس
ولبسوه بيكون سقع.
which بالعكس babies tend to have a little bit more colic than other babies.
Okay.
بس هيدي الشتشدة اللي انت عم تحكي عنها سينتيا it doesn't mean انه البيبي has colic. It actually doesn't mean that the baby is in pain. يعني انا على طول بقول لهم للمامز تبعوا البيبيز بشدشوا كثير between the 1st and the 2nd month of life. كأنه ما عارفين إنه when they feel that they have gas, they need to let go, you know? So they fight it and then they become more irritable. They don't know what to do, basically. They need to learn how their body functions.
Okay.
So they don't necessarily go together.
Okay.
لأنه a lot of
Okay.
babies they have these straining episodes or شدشدة but they don't necessarily have colic.
Okay. It's amazing to correct misconceptions عن جد and when we hear from the community وأنا ما this is
ايه
not my field عن جد it's amazing to hear this and I hope all moms will benefit from this لأنه هيك it will correct the misconceptions and things they might hear from the community, you know?
yes yeah there's
So
no
it's
real
just,
treatment for that.
yeah, it's just doing your best in terms of skin to skin, holding the baby tummy down, صح? Just like below the tummy?
It can help إذا colic is due to gas لأنه when
Okay.
you put pressure on the baby's stomach they
Mm.
might release the gas so it might help this way. بس إنه magical solution لا, we just need to like buy this time basically.
Okay.
And
What
it
would
can
you
be very frustrating.
جاية أسألك what would you advise to moms and dads شو الأدفايس اللي ممكن تعطيهم إياها so that they don't get too frustrated whenever the baby is crying, you know, non-stop for 3
Yeah
hours. I mean, that's huge.
yeah so مثل ما عم بقول colic happen مثل ما قلنا between 3 weeks and 3
Mm.
months
Mm.
and this is typically the time when moms and dads are sleep deprived.
Mm.
They are tired, they are frustrated, and the baby is crying
Exactly.
all the time.
Mm.
So it's not easy, أكيد. And actually, in some cases, we see child abuse because of
Oh my
crying and
God,
colic.
yes.
بنسميها shaken baby syndrome.
Mm.
So
Like
it's
shaking baby
when
non-stop.
exactly. So it's actually when parents hold the baby or they shake the baby like that, asking the baby to stop crying.
Mm.
Okay, so they lose it sometimes. We see it, it happens. So what I recommend is for parents to take turns. Okay,
Okay.
so mom can stay with the baby for some time and
Okay.
then she really, really needs to leave and
Okay.
let someone else handle the baby.
Okay.
Okay,
Makes
لأنه
sense.
مثل ما قلنا سينثيا it's not rocket science يعني
Mm.
the baby will cry no matter what you
Mm.
do. مش انه ما رح يهدأ الا مع امه مش انه بس رضاعة رح تروقه you know so it's best in this case to actually have people help with the baby. The mom can take a break, the dad can deal with that, the dad will take a break, the teta can deal with that. يعني people can
So
take
take
turns
turns.
especially if it's happening مثل ما قلنا 3 times a week or more.
Exactly. Okay. Perfect. We have a question related to gripe water. كذا حدا سأل إنه does it work?
So gripe water is also another placebo. So it can work in 50% of the cases, but
Okay.
it's due to chance. It's not
Mm.
due to the medication being effective.
Okay. Okay. Placebo. deal. And usually what are the possible causes just تننهي colics هن ممكن too much gas or if baby is not breastfed.
When the baby is not breastfed, it will happen more لأنه formula produce more gas.
Mm.
And when they're drinking from a
Bottle.
bottle, they
Exactly.
also, they also بيبلعوا more gas with that. Yeah.
Okay. Any other possible cause?
For colic?
Mm.
Not really.
ممكن just in case we have a cow's milk allergy, if we have colics associated with maybe greeny stool or rash, this is when you diagnose that, you know, it is an allergy, right? لما
So
كان
this
بدنا
is
يفكروا
not
إنه
colic.
colics.
Hey.
Okay.
So colic مثل ما قلنا it's a category نحن بنسميها بالمedicine diagnosis of exclusion. يعني
Okay.
when we cannot find another name for what's
Okay.
happening, we call it colic. Okay.
Okay.
هلا
Okay.
cow's milk allergy is a completely different problem.
Okay.
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 لأنه cow's milk allergy is when the child has an allergic reaction to cow's protein.
Okay.
Okay. Which usually has other symptoms with it. They can have a rash on their face, diarrhea, mucus in the stools, blood in the stools, pain, irritability, poor weight gain,
Okay.
inability to sleep, etc. كل هالاشياء.
Amazing. Okay, perfect. So just to summarize, colics, they usually have a baby crying for 3 hours, 3 times a week. It's usually at night. It starts after the third week of life and goes away by the third month. So بين الشهر وشهرين. Usually the cause is too much gas or, you know, formula. Other than that, also 40% most of the time of babies have colics. And just as a kind advice from Dr. Rana Sharara, take turns. ما تخلوا حالكم انتوا to hold the baby for consecutive 3 hours لأنه أكيد it will make you so frustrated. So take turns بين بعضكم.
Yeah.
So I think that's it on colics, doctor. Do you want to add anything?
Not really.
Okay, perfect. So let's move to reflux. So هيك we can make the difference between both of them. لأنه sometimes I see moms and dads frustrated. عم يبكي البيبي مش عارفين إذا colics, مش عارفين إذا reflux, مش عارفين إذا بده ياكل, إذا في داكو, So it's a combination of so many things. So to
Yeah.
help them out, let's talk about reflux, and we can start by you defining reflux, doctor.
So reflux is basically the way إذا بدك anatomy is يعني the way we are formed is we have our mouth, okay, where we eat and consume food, and then we have the esophagus اللي اسمه بالعربي المريء, okay, which is the tube that connects the mouth to the stomach.
The stomach.
Okay, and the stomach is then connected to the intestine. Okay. Reflux is whenever the sphincter between the esophagus and the stomach is not closed well. Okay. يعني
Can I show you a picture? Hey, it's
Sure.
easier for you to explain to them. So I got this one.
Yes, exactly. So
here.
This is the sphincter. يعني إذا بدك مثل كأنه عندك مرتبين ضغط.
Yeah.
Okay. والضغط منه مسكر مظبوط. Okay. إذا عبيتيه it will leak out. Okay.
Exactly.
So basically this is what's happening. The sphincter literally acts like مرتبين الضغط لأنه it's actually really strong. It has muscles around it, and it prevents the milk from going from the stomach to the esophagus.
Okay.
And this is very important لأنه if you imagine babies, they are lying flat most of the times. They are on their stomach, on their back. They're lying flat, and they are on a liquid diet. Okay. So they are on their back on a liquid diet, and the esophagus is really short. Okay. لأنه هن babies. So أكيد they will reflux. Okay, it's expected. It's normal.
Exactly. Okay.
So reflux per se, أنا على طول كمان I always try to explain to my patients the difference between reflux and reflux disease. Okay.
Exactly.
Reflux is very common. Okay. A lot of babies have reflux. Actually, most babies have reflux. Reflux disease, it's when this reflux is causing problems. Okay. شو هن البروبلمز؟ The problems are pain. يعني كل ما الولد يشوف البطل أو يشوف البريست, the child will cry. The baby will cry when they start feeding, whether it's breast milk or formula. They might cry every time you put them on their back. So pain, and they might arch من الوجع. They might completely arch. بيعلوا إجريهم. So these are all signs of pain. In addition, reflux بيعمل more vomiting. Okay. مش بس spitting up. Okay. A lot of babies spit up.
Yes, exactly.
This is part of reflux, not reflux disease. Okay. With reflux disease, they spit a lot and they vomit. Okay. يعني بيستفرغوا مش بس بيدشوا بيطلع أكل. So this is another symptom of reflux. The most important symptom of reflux is poor weight gain. Okay. لأنه الولد ببطل بينصح because of the effects of the acid reflux on their body and because they don't want to eat anymore. Okay. So whenever we feel that the child is in pain, the child is not sleeping well, not eating well, vomiting a lot, and not gaining weight, this is what we call reflux disease. And this has to be managed. ما ضروري بالأدوية, but it has to be managed.
How do you manage usually, doctor?
So أكيد, first of all, we want to avoid medications. Okay. And we try بنسميهم نحن إذا بدك physiological maneuvers. يعني the head of the bed has to be 30 degrees higher than the stomach. 30 ما كتير. Okay. يعني بدل ما يكون التخت هيك بكون هيك. Okay.
Doctor, they usually do that إذا في GERD, إذا في reflux disease, or able to prevent it. لأنه كمان we get this question a lot.
So I actually recommend the head of the bed to be elevated in all babies. Under 4 months of age. Okay. Above 4 months it doesn't matter لأنه ممكن يقلبوا ويناموا على بطن. But under 4 months of age فينا نعليه 30 degrees to prevent مش بس reflux disease, to prevent reflux لأنه بضيقوا reflux.
Exactly. Okay.
So the head of the bed 30 degrees يعني basically just enough to have the head of the baby be higher than the stomach. Okay. So this is one thing that we can do to avoid reflux. The other thing is بعد الأكل دغري the baby can be vertical. Okay, so the baby can be held vertically or the baby The baby can be held vertically or can be placed in the car seat or on the boppy, the pillow. They can be منشان كمان ما يعملوا reflux this way.
Okay.
The other thing that we sometimes resort to is إذا الولد is a happy spitter. يعني بيتدشى كتير بيطلع كتير أو عنده some reflux بس ما عنده reflux disease. The child sleeps and is gaining weight and كل شيء بس the amount of reflux is annoying for the parents mostly لأنه بيغيروا له 100 مرة بالنهار. I would recommend giving small feeds but more frequently. Okay. So if the mom is exclusively breastfeeding, she can breastfeed from one side, give the baby a break, a long break, and then breastfeed from the other side. If the baby is bottle fed, break it, مش بس in half,
between.
but break it حتى like kill 30% to give the child a break. Okay. So these are some maneuvers that we can use.
Okay. So
Putting
just
the
to
baby
make
on the tummy بس كمان بدي أزيد هالشغلة إنه sometimes putting the baby on the tummy can help but I never let my patients put the baby on their tummy to sleep. Okay, لأنه this will lead to sudden infant death syndrome. So if the baby has reflux and the parents want to calm the baby down, فيهم يحطوه عليهم. Okay, which means the mom is not getting sleep as well, but it's better to be safe in this way.
وهيدا just like 15 minutes to 20 minutes after the feed عليهم صح؟
صح.
Okay, deal. So doctor, how can we, just to summarize, make the difference between the reflux and reflux disease? So reflux is just a normal baby a bit fussy, like baby crying after the feed or while
حتى
feeding?
ما ضروري يعني reflux usually reflux doesn't affect the child. Okay, it affects more the parents. يعني بيصيروا بيقولوا لك انه عم بضل عم ببقبق عم غير هيدا 100 مرة بس you examine the child, he's happy, he's gaining weight, sleeping well, the stools are normal. This is reflux. Okay, but it's not reflux disease.
Okay, it's only a disease when the baby is losing weight, when the baby is vomiting, not spitting, right?
Yeah, and when they are in pain, أكيد.
In pain, exactly. Okay, perfect. عم شوف هون كمان شو عندي questions. We talked about how we can prevent it and avoid it too with the idea of having the baby after the feed مش دغري نحطه بالتخت نعلي البيد كمان 30 degrees.
Burping, we recommend burping in younger children لأنه burping بيطلع الهواء اللي الولد كمان بيبلعه. I saw someone ask about formula versus breast milk. أكيد formula fed babies are more prone to develop reflux than babies who are breastfed, whether it's reflux or reflux disease. Okay. So definitely, but this doesn't mean that babies who are exclusively breastfeeding do not get reflux disease. They can get reflux disease. Okay. So it happens.
بنعلي chances of having reflux disease إذا we don't pay attention to the things that can prevent reflux to start with?
Not necessarily. Okay. So a lot of babies have reflux, they never develop reflux disease. Okay. A lot of babies have reflux disease without symptoms of reflux. بنسميه silent reflux symptom. So these babies, they don't necessarily vomit or spit up, but they don't sleep, they cry every time you feed them, they are in pain, they crunch. This is بنسميه silent reflux. Okay. So these are some of the cases that we actually sometimes يعني شو ما عملنا مرات we have to resort to treatment. But we try قد ما فينا not to give medication.
To start without it. Okay. What are the possible causes, doctor, other than having the sphincter weak or loose, and the normal thing that happens with newborns?
So there are no other reasons actually that cause reflux. يعني unlike adult, where the stress can cause reflux, type of food can cause reflux, chili food, tomato, etc. بالولاد it's really mostly a sphincter problem. ومثل ما قلنا بالفورمولا a bit more لأنه الفورمولا heavier and they tend to consume usually larger volumes and to swallow more air with it. So formula fed babies have a little bit more reflux كمان. Okay.
Definitely.
So the Yansun does have some relaxing effects. We all know that. So what I recommend is for the mom to drink Yansun. Okay. And the baby will get some of that relaxing effect rather than give it to the baby.
Okay. When we're talking about for colics, right?
Yeah, for colics. أكيد ما عم نحكي for
definitely. Exactly. Okay. We have another question previously asked, Kamin. Is it true that milk deposit on breastfeeding child tongue is a sign of reflux?
No.
Mm.
لا، لأنه هيدا الملك ما عم بيطلع من stomach on the tongue.
Mm.
Okay,
Mm.
هيدا الملك is from the breast milk, from breastfeeding.
Okay. Okay.
Okay, so babies who breastfeed and babies who are on formula can have milk deposits on their tongue. And بنصح أنا يجيبوا شاشة little gauze يحطوا عليها بس شوية مي شرب and they can scrub it to clean it كأنه they're brushing the baby's teeth.
Exactly. And if it's not going away, sometimes it's something else. It might be a
Yes.
fungal infection and things
Yes.
like that, right?
So if it doesn't go away, you cannot scrub it off and the baby is in pain or the mom has pain on her
Stabbing
nipple,
sensation.
stabbing sensation or burning sensation, بكون اثنيناتهم عندهم fungal infection. So that needs to be treated as well.
Exactly. Okay, so from my part, من هون ما بقى عنا questions. You have a question here. Doctor, what shall I use to keep a newborn in an inclined position during sleep, as you said? So when we
Yes.
talked about the bed, right? Skin to skin.
So ideally the recommendations of the American Academy of Pediatrics is إنه ما نحط ولا pillow ولا
Okay.
sleepy head ولا nothing. Okay, so usually we recommend just the الماترس كلها مثل ما هي نعليها 30 degrees. Okay, كيف فينا نعليها؟ إذا البيبي عم بنام بباسينات فينا نحط books or magazines under the bassinet and lift it like that. As the baby is sleeping in a crib, I would recommend putting things under the mattress. Okay, like command books or magazines to lift the mattress 30 degrees. Or we can put the pillow under the sheet. Nothing inside the bed, no pillows, no sleepy heads, nothing. The other thing that we should be careful about is to lift only 30 degrees. 30 degrees is not a lot. Okay, it's just like that. If we lift 45 degrees, the baby رح يقشط. Okay, so we have to be careful كمان.
Okay. في كمان مثلا the next to me I know في things that can أصلا بلا ما نحط شيء تحتهم like you can elevate a little bit, right?
أكيد إذا في some cribs or some beds now that come with the technology where you can just lift them up, so you can use that as well.
Okay. So since I know not in لأنه في عنا هون there's a special pillow you can use any pillow بس تحت التخت not على التخت.
ايه والشرشف يكون fitted sheet يعني يكون really tight around it.
Exactly.
I think someone was asking a question about medications for reflux as well. So مثل ما قلت أنا I really prefer not to treat with medications لأنه in the newborn phase there are some medications that are safer. Okay, but nothing is really 100% safe. And we've had several medications that we used to give that بعدين were recalled or like showed that there's no benefit. Sometimes as a reflux is very severe, preventing the child from gaining weight, etc., then we do treat. Okay. Usually we treat with things أكيد سامعين بالنكسيوم وبهالأشياء اللي هن proton pump inhibitors. بس كمان they are not without side effects. Okay. يعني إذا الولد بقي عليهم for a long time, it can affect the bone of the baby. في some cases babies who stayed on Nexium for a long time أدت إلى osteoporosis بعدين. يعني it's really not a joke. Okay. وحتى ال H2 receptor blockers مثل الرانيتيدين وهولي كمان they were shown to have some side effects in babies in really young babies. So if we can avoid it, it would be better. But sometimes when it's really a disease, we have to like مثل ما بقولوا bite the bullet يعني بدنا ناخد إنه ال benefits outweigh the risk إذا البيبي ما عم يكبر وما عم بينام and we just need to treat.
Exactly. So we don't go to medications دغري. We try natural remedies first, and then if the baby is not gaining weight, if the baby is not sleeping well, we go to medications.
Yes.
Okay. Is it normal not to have baby burping until the next meal, like after 3 hours? And can we put the baby in bed without burping? That's a very good question.
So البيبيز اللي ما قدرنا ندشيهم I كمان raison de plus إنه نخليهم vertical أكتر after feeds and to raise the head of the bed. Okay, and don't worry إذا ما دشيتون they're not gonna choke, nothing's gonna happen to them. They have a normal cough reflex, they have a normal gag reflex, and they have their head turned. So إذا دشوا بيرجع بينزل على جنب.
Okay. Doctor, when you say بنجرب ندشي قد ايه بتنطري على بيبي وقتها بتدشي؟
So if the child is breastfeeding, between the two breasts, I tell moms يجربوا
To
يدشوا up
burp,
to
yeah.
10 minutes. So to burp up
Okay.
to 10 minutes. And after they complete the meal, 10 to 15 minutes. Okay?
Okay.
طبعا ما في sharp rules. Okay? Some babies
Exactly.
burp in 1 second, some babies burp in an hour. But I always tell
Exactly.
them don't spend 1 hour trying to burp the baby لأنه by the time they burp and you change the diaper, it's time for the next
For
feeding.
another feed.
Yes. Okay,
Exactly.
so usually 10 to 15 minutes, and if they don't burp, I would just put them, with the head elevated and just let them, get the gas out. It's just gas. هيدا بده يطلع يا
Okay.
من فوق يا من تحت.
Okay. Okay. Someone is asking, you mentioned burping until 3 months of age. What about after 3 months? Should we still burp?
So you can try. Okay,
Okay.
so هلا البيبيز who are exclusively breastfed, sometimes they don't burp لأنه they
Mm,
don't swallow a lot of air when they are breastfeeding. مع
very good.
البطل they tend to swallow more air. So
Mm,
so after 3 months, I would try 10 minutes. They did not burp,
okay.
I would just put them.
Okay. Perfect.
Please don't give any medications before consulting with your pediatrician.
Mm,
لأنه في medications that are advertised as safe for
yeah.
colic that are not really safe.
Fortunately.
Yes,
So,
okay.
okay.
So always check with your pediatrician. Try not to give any medications if you are exclusively breastfeeding in order not to alter
Mm,
any of the flora of the
mm,
baby.
mm,
I hope now we clarified the difference between colic and other things
exactly.
like cow milk allergy or reflux and هالاشياء, so that
Okay.
it's not confused.
Thank you so much, doctor. If there's nothing
You're
else to
welcome.
add,
Take care.
I'll leave you هيك شوية free time كمان. So thank you so
Okay.
much. It's a pleasure having you always, Angela. Thank you for your
Thank
time,
you.
doctor. Thank you
Thank
so much.
you.
Bye,
Bye.
doctor. Bye. Bye.